Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. We're going to get right into it. Today is Tuesday, October 29th, 2019. It is World Stroke Day. Did you know that 1 in 4 people will have a stroke in their lifetime? So pretty much one of us, and yeah, sorry to throw you in there, Ken, but one of us is going to have a stroke in our lifetime. But the good thing about it is if they're caught early and you have the right kind of post-hospital skilled nursing care, a lot of people just rip right through it. It's not even a big deal. So sometimes there's, different ailments that come along with it that stick with people. But again, having the right kind of care, going to a comprehensive stroke center, call 911 when your friends or family members have a stroke, a little PSA there, so they, the fire rescue can take you to the proper hospital. They know what to do. And then when you get discharged, of course, you need that care as well. So I just want to start out with the World Stroke Day. So we're going to get right into it. Tonight, we're going to be talking about skilled nursing care, what happens when you're released from the hospital. And it's that time of the year, so we're going to talk a little bit about Medicare, all these plans, how to navigate them. It's a lot going on with that. So without further ado, I want to welcome to the program Perlinda Holiday. She's the hospital liaison for HCR Manor Care. Perlinda, welcome to the program. How are you doing this evening?
I'm well, David. I'm well. Thank you for having me. I've been a part of this industry for about 30 years, so I'm happy to be here to share my expertise on HCR Manor Care and the services that we provide.
And we're so happy to have you on this adventure of health. And tell me who you brought along this evening.
I have Frankie with me today. Frankie is our guru case manager that covers, navigates the care for our patients that are going through their managed care programs.
Frankie, welcome to the program.
Thank you.
I'm going to say your last name, Frankie Niedzialer.
Correct.
I got it right.
Perfect.
And you are an RN.
I am an RN.
Registered nurse.
Yes,
wow,
I
welcome
am.
to the program. So
Thank
happy
you.
to have both of you.
Thank
So
you.
let's get right into it. You talked a little bit about your background, Perlinda, if you want to add a little bit more, or tell me, second part of that, the medical specialties that HCR Manor Care offers.
Absolutely. HCR Manor Care. Well, the first thing I'd like to say is that HCR Manor Care has been acquired by ProMedica. And what that means is that ProMedica, the acquisition between HCR Manor Care and ProMedica, now makes us the largest not-for-profit post-acute care provider in the country. Excited about that. We're located actually in 27 different states. We offer skilled nursing facilities, assisted living facilities. We offer memory care. We offer hospice. We also have outpatient rehab. We have home care. And we also have hospitals up in the Ohio area. So really excited to be on a part of the ProMedica network.
I didn't know that. That is awesome. So congratulations. And that is a huge network. I think you said 27 states.
Yes.
Correct.
Obviously here in South Florida and the Delray Beach area and other places. So we have an older population here in South Florida, of course, because it's always been the place to retire. However, also, my parents, the baby boomers, are starting to,
Yes.
age a little bit as well. They're
Yes.
living longer, so
Right.
that's good. Everyone's living a little longer, which is great. You have octogenarians, people living past 100. I have doctors on here all the time telling me about their 105-year-old patient today or 106-year-old patient. And just add one thing, I'm a former newspaper reporter. I once interviewed a woman who was 112 years old and had all of her marbles. I mean, it was amazing. So people are, and that was just a few years ago, 10 years ago. So people are living a lot longer. So it's important to have, obviously we don't want people staying in the hospital too long. The hospitals don't want that as well. There's a chance of infection. There's protocol that they have to follow. They can't keep people in the hospital too long, So when a doctor discharges a patient, it's like, what happens next? Where's that that path, and that's what your company specializes in. So tell us a little bit about, the post-hospital skilled nursing care.
Okay, well, typically my role as a hospital liaison, I visit my various hospitals, and more specifically, I visit Bethesda Hospital, East and West, and also JFK and Lantana. And I help with the case managers. I meet with them daily, for bed management, and I help with transitioning the patients into skilled nursing facilities for the services and care that they need. At HCR Manor Care, we provide various different types of therapy. We have cardiac rehab, we have stroke rehab for patients, we have neurological, we have physical therapy, occupational therapy. We also have patients that require wound care management or medication management, so we're able to provide all of those services through our nursing care and our nursing team at our centers.
That's important, all those management, because these are orders from the doctor directly,
Correct.
Right? So the patient has left the hospital, hypothetically they had a stroke, and then they're able to leave the hospital, the doctor gives the orders. The healthcare skilled nursing is brought in, you guys are called, or you help with that pathway, and then manage, everything like you said, from the medicine to the,
diabetic teaching as well. Right.
And you were telling me even physical therapy
Physical
before.
therapy, absolutely.
That's very
we work
important.
a lot with the orthopedic. My facility is Delray, Manor Care Delray. We're very close to Delray Medical Center, which is trauma. So we do get a lot of trauma alerts coming into that particular facility.
Yeah, that is a level 1 trauma center.
Yes, it is.
That and St. Mary's Medical Center are only two in Palm Beach
feeds
County.
into our northern Manor Cares.
Yes.
Yeah, so this is a very important part of the puzzle
Absolutely.
of healthcare in South Florida. I don't think people realize that.
Yes, we have 7 facilities actually on the
Whoa.
East Coast. We have 2 in Boca, 1 in Delray, as Frankie mentioned. We have 2 in Boynton, 1 in the West Palm Beach area, and also 1 in Palm Beach Gardens. And then we have 4 other facilities on the West Coast, 2 in Naples and 2 in Fort Myers.
You got South Florida and Southwest Florida covered.
Yeah,
That's great, and
yes.
thanks for sharing that, because we're sitting here in Boca Raton.
Right.
I love to localize it when we can.
Absolutely.
Absolutely.
You mentioned Delray as well, Boynton, I think West Palm and Palm Beach Gardens, where I was actually born. So like to hear that. I was born at Palm Beach Gardens Medical Center, so
Wow.
they don't do OB anymore, but Jupiter does now. So
Yes.
Jupiter didn't do it when I was born, so that's how it works sometimes. All right, we're here with Perlinda Holiday, HCR Manor Care, and Frankie Niedzialer.
Correct.
2 for 2?
2 for
Nice.
2.
Wow, that's awesome.
You're doing great.
And you're an RN, so you talked a little bit about the chain of care there as well. We talked a little bit about the nursing and rehabilitation centers and where they're located. You kind of touched on this. Most common ailments, obviously, stroke. You said, heart, ortho. When someone breaks their bones.
We have a lot of joint replacement surgeries.
Oh, yeah,
We also do a lot of things with cardiac rehab for our patients. One of the new programs that we started working on with JFK is our LVAD program, which is something new. Not a lot of facilities are able to do that. And we're doing that currently now out of our Manor Care of Boynton Beach Center, and they're just doing phenomenal with that.
You said LVAD, so that's heart. That's left ventricular assist device surgery.
Yes. Yeah,
I once had a cardiothoracic surgeon in here sitting in that chair right there.
Wow.
Who told us about LVAD. Wow, that's an amazing procedure. So that's for end-stage heart failure.
Correct.
So these people who are eligible for LVAD, they're pretty much in the past they were probably sent to hospice, and it was an end-of-life type of care. But now, because we talk about it all the time, the medical technology is moving in the right direction
Absolutely.
so fast. Now we have cardiothoracic surgeons and heart surgeons, able to help someone with, a new heart system. I won't go too much into that because we'll let the doctors go, because that is a very technical surgery as well. That's great, though, that you're helping out with that. Like you said, you mentioned, cardiac care, diabetic care, so that's huge right now. Diabetes is obviously on the rise for, different reasons. People are living longer, the lifestyle in the U.S., etc. but wound care is so important.
Absolutely.
That goes along with that.
Absolutely.
And there's a lot more procedures vascular surgeons are doing too. I know from my little stint in healthcare how many different things they do, and what kind of care is needed. Oncology care, so that's
we
cancer
provide
care.
that.
And we also get a lot from Kindred and Select, a lot of respiratory. We do a lot of trach care. We
Okay.
have nurses specializing in the trach care, which is good. We also do PICC lines for people that have to come and have IV antibiotics.
Of
So,
course, and that goes along with dialysis too,
we
right?
do dialysis, absolutely.
Dialysis access. What don't you do?
Do everything.
We try to do it
You're
all.
quite a company,
We try to be a leader in the industry.
Yes, we
Yeah.
are. We
Yes.
And they've hired two great people like yourselves.
Thank
I mean,
you.
you're great spokespeople for HCR Manor Care, and I know
you.
you do a lot on the the hospital liaison side as well. I should mention. So yeah, you have all these facilities here in South Florida and beyond. What's in the future for HCR Manor Care? I mean, you're already doing so much, but is there anything you can kind of share with us, or
Well,
I don't want to put you on the spot?
Well, as I said, with ProMedica,
that's
being
the big
our
thing.
new parent company, they are really a leader in the social determinants of health. And that's one of the things where they're trying to provide, their vision is to provide and create an environment where everyone can receive their maximum level of health. And we want to make sure that everyone has their health and well-being established. So what we try to do is help individuals. What we do is we look at their prior level of function, and we try to help them and make sure that we are a resource to them and provide them with solutions for whatever their healthcare needs are. So that's our goal, and to continue to be a resource for those patients.
Now, is HCR Manor Care just at the locations, or do you actually go out to homes as well? How does that work?
Well, we do provide home care, not in all of the areas, but we do provide home care services in some areas of the United States.
But the majority of the care is at the HCR Manor Care.
Within our facilities, correct.
Within your facilities. Wow, that is amazing, news to get out to South Florida and beyond. Again, it's I haven't given out yet, so it's not again, but it's
Right.
heartland-manorcare.com.
Yes.
I want to get that dash in there because that's very important. Again, it's
Yes.
heartland-manorcare.com. I'm on their website right now. It's very easy, navigable website. You have care settings on there, outcomes, treatment, expertise, resources. Everyone can click right there. And it's hard to believe we're already halfway through. Going to take a quick break. And on the other side, we're going to talk about Medicare because open enrollment's just around the corner on the Living a Longer and Healthier Life show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470 and we will put you on the air to inform all our listeners. Now, back to our show.
South Florida and beyond, and welcome back to the Living a Longer and Healthier Life show. We're here with Perlinda Holiday and Frankie Niedzialer from HCR Manor Care. It's heartland-manorcare.com if you want to find out a little bit more, but we'll give out some info and even a phone number. But as I promised, I want to talk about Medicare open enrollment. I do find out sometimes it's a little confusing, all these commercials I'm hearing on the radio.
I know.
Of course, driving around. So let's talk a little bit about, Frankie, because this is your expertise. I mean, you do central intake. You help people navigate through Medicare. This is what you do every day.
Absolutely.
So tell us a little bit about all these choices and plans and what to do.
Sure. To clarify, I like to go through traditional Medicare. Traditional Medicare is A and B. Under traditional Medicare, under A, Medicare would pay for your inpatient skilled facilities, such as SNFs and such as acute cares. Part B pays for your wellness, for your durable medical equipment, for your wound care supplies. That's traditional, okay? There are two types of patients that cannot leave traditional. That are people on renal and stage renal disease, okay, and hospice. Medicare CMS would prefer to do their own case reviews for them. But everybody else eventually will be put into a managed care. In our area, in South Florida, we have a couple big players. We have Blue Cross, we have Simply, which is down more towards Broward, we have Cigna, we have Aetna. Those are the big four players that we have down here. You can be part of an HMO, which means that you have a primary that has to give you the referral base, and then you have a PPO plan, which means you can go pay per service wherever you want. The difference is the price of the premium. That's it. So the one thing that managed care does give you is they give you a lot of advantages, such as silver sneakers, which is a club membership for gym. You have dental, you have eyeglasses, not hearing aids. Medicare does not pay for the hearing aids, but there are a lot of little benefits that you do get with managed care that you don't get with traditional Medicare. As far as it really is a personal decision who you go with, and a lot of these places are going into our senior communities. They are having fairs. Be informed. Ask what the premiums are. Ask what the differences are. My job with HCR is when I look at your managed care only. I don't do the traditional. And I look and I try to get you the best level of care, the number of days that you're allowed to come in. I work very closely with all my, like UHC also is very big. I didn't say that. Right. United is very big down here too. And I have contacts, other nurses, and we case conference. So it's a good process. She gives me the referral. I contact the insurance companies and I try to attain the best care for you based on your prior level of function, how you were prior to hospital, and how you are at the day of discharge. That's how managed care assesses what we're going to be able to give you. Straight out, your prior level of function and your home environment if you live alone, because discharge planning has to be safe.
Oh yeah, definitely.
It has to be a safe discharge planning. But open enrollment is now, if you have questions and you're an internet person, www.medicare.gov gives a lot of QA. And like I said, be informed. Go to these facilities that are having, sometimes have them too. The Aetnas will come in and they'll go through everything. Sometimes they have lunches for you and, or little snacks. But it's your right because it's your Medicare of what you choose.
Yeah, it is your right. And definitely inform yourself.
Inform.
We've had Louis Biasi on the show before, and he always says that same thing as well. Just so you know, it is people's choices, but so I can go a little bit further. So there is the option that people have. They can, choose a Medicare plan where maybe they don't think that they'll have any issues this year, and they pay a lower premium and keep out of the hospital. Kind of what no, I'm not that young anymore, but what young people were doing a few years ago with their healthcare, right?
Exactly.
Like kind of gambling, like nothing's going to happen to me.
Right.
Why do I need health insurance? So you can kind of do that on one of those plans too. Am I right?
Correct. And the other thing is, people don't know this. At the end of on the 30th day or 31st day of every month, you can opt out.
Oh, I didn't know
You can go
that.
to a different plan.
Whoa,
Absolutely.
that's huge news. I mean, we've never talked about that on the show. That's great. So yeah, so people have the choice, and really, and what I was getting to, if people want to take that chance and not have the coverage now, if something happens, boom, they're paying a
Exactly.
very high
So
cost,
some people
right?
decide they don't want the HMO.
Yeah.
They want the opportunity. You know, money plays a big part with our seniors.
Of course.
So, I mean, that's the
Fixed
main,
incomes, right.
that's the
Fixed income, yeah.
catalyst for choosing HMO versus PPO. But just know that your facilities, your inpatient facilities, it doesn't matter. Where it matters is your physicians.
Yeah.
And that you have to go through certain assigned facilities for MRIs, all that, x-rays, where PPO you can go into mostly every place you want. So it's convenience, a PPO.
This is the best explanation we've had on the show. We got to have you back on during open enrollment. This
There
is
you go.
great.
Yeah.
So I didn't know. I was thinking open enrollment starts soon, but it's already going on.
Yeah.
It's going on. It's
Oh, wow.
it's always like the end of October, November.
Yeah, that makes sense.
Because
Yeah.
it's just like
I'm
the
hearing
private
from
sector.
my insurance company right now about my selections.
There you go.
know.
Like
Right.
us
Same
too.
kind of thing.
This is just it for Medicare and commercial.
So it is ongoing. But the neat thing that you said is at the end of the month, if you want to switch to
I've
another
seen
one.
people go back to Medicare, traditional
Yeah.
Medicare,
So yeah, that
if
is.
they want.
Huh.
They have a right to.
It's your right.
It's your right.
That's what Lou Biasi always
your
says. So
right.
that's why I mentioned his name twice, because he
Right.
always says
Exactly.
you're right.
It's your right.
This
And
is
we are
what you have.
proactive with our.
Yeah, you know
we,
the
We
landscape,
love our
but-
seniors.
Yeah.
I mean, we're in the senior business, so this is what we do.
Exactly.
And it's so important here in South
Mm-hmm.
Florida. We have great people here. So that is great info. It's Frankie Niedzialer. Did I get it right again?
You got it.
I'm not even going to ask anymore.
Just
All right.
Frankie.
All right.
That's fine. We'll just go with Frankie from now
Okay.
on. Central intake, and also you help with the navigating, the Medicare landscape for HCR Manor Care. And I'll give out. You said I could give out a number for the Delray here
Sure.
Center
Admissions
HCR Manor Care.
department, please.
Yeah.
And if they want to call me, ask for Frankie. I'm the only Frankie in the building, and they can call me if they want to just ask a few questions, and I will help anybody.
So it's 561-638-0000. I'll give that out again for the end of the program. Again, 561-638-0000. And ask for Frankie if you have any questions and anything we talked about this evening. That is great info, because it's great timing too, as well with everything that you do. So yeah, we started out. We've a lot of information today. A great company. You guys do so many different things: skilled nursing and rehab. Post hospital skilled nursing care. We touched on a lot of it. Cardiac care. We talked about diabetic care, oncology care, orthopedic and joint care, outpatient therapy. We talked a little bit that you do that, but mostly in house. But that
Correct.
is available
Right.
with HCR Manor Care. We have less than 2 minutes. Let's talk briefly pulmonary care. This is huge. COPD
Yes.
is one of the biggest things going on right now.
Yes.
Due to what people have breathed in over the years, whether it's smoke, whether it's paint chips, whatever, the environment, right?
Yes.
So you guys are expert in pulmonary care as well.
Yeah, we're providing respiratory services to our patients as well that require it there at the facility. And, I just wanted to say that, if anyone has any questions about something that perhaps we didn't get too deep into, I'd like to give out my number as well.
Yeah.
And I can be reached at 561-891-1664. And as I said, I'm the hospital liaison, so I try to help them transition patients into our centers.
That's great. And I want to thank both of you this evening again for coming on. Great information. Perlinda Holiday, hospital liaison, and Frankie, the RN over at
Thank you.
HCR Manor Care. And if you have any questions for Frankie, her number is 561-638-0000. Ask for Frankie. And we'll have to have you on again. It's hard to believe we ran out of time.
Oh, it's over?
It's over.
It's
That's
over
it.
already.
Yeah. Want to go another half hour? Next time. We'll see you next time on the Living a Longer and Healthier Life show.
Thank you.
Thank you for having us.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.